Mark and Ruby, welcome to Election 08.
Good to be here.
You both work very closely to Grassroots New Zealand. What are the key issues, the key health issues facing Kiwis right now?
I think when you're talking about health, for me, poor health is about the health of the poor. At the end of the day, children who are in homes where there is poverty are 3 times more likely to be hospitalised. So you've got to say that poverty and health go hand in hand. Issues about diet, about housing, about immunisation, all of those things are impacted by poverty. So, and access issues, access to getting the health care that we all think is very available, but when you're poor and you haven't got a car or you've got little kids and you can't get out of the house, you know, poverty is the big thing. And so, you know, families who are struggling, trying to often, you know, work 2 jobs, just getting to the doctor with the kids is another big issue. The PHO system, which ties people to local communities, so you sign up with the local doctor. But the reality is that for lots of people they're transient because they keep trying to find a cheaper house or they can't pay the rent, and so they move on. So the PHO system just doesn't work for them. Our society is structured for the middle classes. It is not structured for those at the bottom of the heap who are really struggling to survive.
Mark, are you seeing the same sort of things?
Yeah, you raise an interesting point about access, and I think it's true because access involves 2 things. It involves the ability to get there, but it also involves the incentive or the psychological makeup to know how to get there. And I think these 2 things go hand in hand. And so, you know, like just take recently, they're talking about putting a 10-cent tax on petrol in Auckland. That's going to make the access a lot harder for people. We've tended to centralise everything, making it more difficult for people to go there. We have had a tendency to create a technological system in New Zealand, a banking system, all sorts of things that make it harder for people to access the advantages of living in a modern world. And the gap gets bigger and bigger. And that's what's concerning me, is I see a large chunk of the society getting further and further behind. And I think you're very right when you say that it's about the health, it's about psychological, it's about spiritual, and it's about physical health and well-being in the community and how you can access those as an individual. I find working with people individually, just giving them information won't do it. Because there's also, how do I process the information? How do I prioritise the information so that I get things in their right order and balance in life? You can tell some parts of the community all the time, you've got to have this, you've got to have this, you've got to have that. But that's not going to change anything.
I think we have a structure too where we expect to provide something and people will come and get it.
Yeah.
And we tell them, go over there and get those things that we've provided. Whereas you actually have to go to the people. In a lot of ways in which we used to go to people, like the plunket nurses and the visiting in home, and you know, people used to be able to have a baby and stay in hospital. I stayed in hospital after my babies for about 5 or 6 days, you know, so that you could get the learning. And we don't do that anymore. We say, all right, come and have your baby and go home, and I'm not sure how you're meant to learn how to look after that baby anymore. We've actually got to say, how do we get the things that people need where they are? And I think it's been a huge change in our society around work, people working long hours, shift work and all this sort of thing. So we need to take stuff to where people are, whether it's to the schools, whether it's to the workplaces, to the local communities. People are going to go down to the mall. So how do we make sure that what they need is right there? You know, let's think about accessing all the services that they might need around health, around parenting support. Maybe we should be basing those at the mall. So some of the old ways in which we've done things that worked for us in the past just aren't working for lots of people anymore. We need to restructure our thinking and say, how do we take this stuff to the people?
One's got to look at the trends over 50 years in New Zealand society and see what has shifted and what has happened, what have been good about those shifts and changes and what have been negative about them. And the answers are going to take 50 years in terms of actually changing the way we do. You know, when you talk about the access, one thing is I'm aware of in Clendon is when I first moved to Clendon 20 years ago, There was 3 banks in the Clendon shops down the road from us. There was a post office. There was all the facilities that you needed. Now they're not there. They're all in Manurewa. How do you get from Clendon to Manurewa if you don't have a vehicle? How do you get your shopping from the supermarket back to home unless you take the trolley down the street with you? You've got no way of getting it there. And so many people are living economically on the edge that it just takes one tiny little thing to tip it over. It may be an extra big power bill, or it may take a health issue and they have to go to the doctor and it's going to cost them.
What would you like to see the politicians do for you in the next government, Mark?
I think there's one thing they could do is they could get rid of this silo mentality of separating everything off, so that this group doesn't speak to this group. So if you've got a need, the health doesn't talk to work and income, doesn't talk to another group, so that you bring it all together. Get rid of these silly privacy laws that prevent people talking to each other, because I think that's just gone out of hand, and people hide behind that. I think that dental idea that has just been put forward of putting dental care on a similar level to healthcare, I think it's a really good one. But I certainly think that they've got to streamline the whole way of caring and put it all together, so you're looking at it holistically, not in separate issues.
Which is the point you were making, Ruby. Your message to the politicians?
Yeah, I think there's been a positive emphasis on early intervention, which is great, and we've seen things happen there, but I think we have to increase that. I'm particularly concerned about young parents, teen parents. I'd like to see some new work being done around that, support for them. So increased support right at the beginning of life, but that's specialised for teen parents. And I would also like to see a real concern about high needs families who are struggling with poverty and other issues, and being able to wrap the support around them, and that travels with them when they move house. Because at the moment everything falls apart as soon as you move. You move school, you move PHO, everything falls apart. Can we have packages of support that will move with families with high needs? That would be great.
Thank you both very much for joining us.
Welcome.